But I do appreciate everybody's grace and understanding during this time.
Great. So thank you, Superintendent Pittman, for inviting me tonight, and to the board. It's a pleasure to be here. It's really actually an honor to be out in the communities and be with you doing your work. So it was really an honor to be here. I am just going to do a couple of slides here that really answer to the questions that you're getting from the community. And I think it's better to understand those answers from the broad perspective and what's actually accurate information, so that everybody feels fully informed. But did you know that it's School Board Recognition Month? And so I wanted to start by thanking you all for your service. You know, our school board members across the county have just shown unwavering commitment to your work. And it's such a, you know, it's been such a challenging 2 years. And the community has been so off balance that your steadiness and strength and resilience has really provided such an important anchor to your families. And I know what a toll it takes on each of us to keep standing, especially as it's been referenced, you know, that the pandemic continues to go on. So I just want to thank you for everything you're doing in the Bayshore community, because we're all committed to every single child in the county, and you especially keeping an eye on yours in the Bayshore district. So we'll go ahead and go to the next. Oh, there we go. So one thing that's been, we've been through many surges in COVID, and I actually have lost track if this is 4 or 5, but we're somewhere around 4 or 5. And the surges, if you look at data that's dotted out on a chart, looks like a roller coaster. And I've learned over time that they actually behave that way too. There's this like slow climb up, and you click, 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 and you keep going up. When you get to the peak, the drop comes pretty quick. And that's happened in every surge that we've had. Right now, of course, we're in the click, click, click up. I meet regularly with our county health officials, and I'm on statewide calls often. Just this morning, I asked our county health officials about the timing, what they think, where they think we are in that upward, you know, climb of the Omicron surge. And they're predicting, this is, you know, crystal ball prediction. But, and just before I came in, I actually saw an article where England seems to have reached its peak, and it's starting to head down, and they feel that the United States is next. So our public health officials said tonight that we're probably looking about continuing a couple more weeks, getting to the end of January as a peak, and then starting to hit the downward trend. So just so you have an idea of, you know, how long this particular challenge might be in front of us. Okay. So today the Board of Supervisors met, and they discussed at length what's going on in the county around COVID. They are continuing to provide support in different ways. They talked about distributing an additional 50,000 at-home antigen test kits for residents who have the greatest needs, including children who are 5 years and younger because they're not vaccinated, from families who are low income or workers in childcare settings, so that the childcare providers can continue to serve children while their parents go to work. And then I made the comment this morning at the Board of Supervisors that the education leaders in San Mateo County are 100% committed to keeping students in school. And so that is every single school district of the 23 school districts in San Mateo County are working very hard to welcome kids into school every day and accomplish all the responsibilities of COVID safety that are on their plates. So the question that I hear from the community this week is, why aren't we closing schools? Because it seems like, wow, this is the worst it's ever been. But I want to take everybody back to March of 2020, when this all first started and hit us. And in March of 2020, that initial surge of COVID was just flat out deadly. The severity was intense. The healthcare systems were overwhelmed. I don't know. I always remember the pictures from New York City and how, they were one of the first cities to really get hit hard in the United States. The health officer in March of 2020 ordered schools to close. We were ordered to close. We would not have made that decision because there's a lot of impact when schools close and kids can't come to school every day. But the health officer made that decision based on public health information about the way in which the healthcare systems were overwhelmed. And everyone in San Mateo County was then ordered into shelter in place. We were the first county in California to go into shelter in place. And then many counties followed suit. At that time, we had very little knowledge about COVID-19, what it was, how it behaved. We just had very little data on how it was going to impact long-term. And the schools at the time had no existing COVID-specific safety protocols. We had to develop those in March and April and May. And then we also had very little access to PPE. That was something, we better order masks and we better order gloves and we better order all this stuff. And everybody was trying to order things, if you can remember, and it was really hard to get. And the biggest thing of all was in March of 2020, not a single person was vaccinated against COVID-19. So we are talking about an entirely different universe. And we have to remember that with the pandemic lasting so long that we still sort of make associations with those initial experiences, but we're in a very, very different place. So where we are now is that we've worked very hard to develop a San Mateo County specific pandemic recovery framework that's been the anchor for all of our school districts. It follows the California Department of Public Health. We work closely with San Mateo County Health to keep that relevant and updated, and everybody has a place to go for the right behaviors. We now across all of our schools have testing protocols. You can do a PCR test, a rapid antigen test, and a pooled test protocol. 80% of our county is vaccinated, fully vaccinated, and above 90% is the vaccination rate on average at every school site for the staff. We have adequate supply of PPE. Our school districts are publicizing their data on dashboards. And we have federal and state money now to support the work that we have to do in order to safely operate schools. Additionally, we have a well-established partnership with San Mateo County Health, and the San Mateo County Office of Ed has well-established partnership with all of our school districts, including our school board members. And so what we've learned since 2020 is actually what we knew in the beginning, was that schools actually need to be open, that our children need access to in-person learning to keep their academic development going, that they need social emotional interaction with peers and caring adults, that they need meaningful engagement and structure, and that in schools we have safety protocols, testing vaccinated staff. Many students are also vaccinated, and a federal, state, and local commitment to remain open for our students. And finally, public health is fully committed to keeping schools open. Our health officer, if he determined that it was not in the, I don't know how to say, if it was dangerous to students to attend school, that it was more dangerous to attend school than it is to be at home in distance learning, they would, or if there were public health reasons why they needed to close schools, they would do it. But they are not taking that action. Something a lot of people do not realize is that the state legislature passed laws last budget season, legislative season, that do not permit schools to go to distance learning. So when you see a headline, Hayward moved to distance learning, that's really, once you read the article, that's really not what happened. There is an independent study protocol you can go to for students who can't attend school. It takes a lot. It takes board policies, processes, paperwork, signatures. It's not just, oh, we're all going to go home now and tomorrow we'll be online. There's a lot of systems that have to be in place for that to happen. So we actually are not allowed by law to go to distance learning. Finally, the healthcare system is managing the surge. Like I said, we meet with the public health twice a week. They give us all the data on schools and they give us the data on the hospitals. There is a little bit of a uptick in hospitals right now, but they're stating that a lot of those people in the hospitals right now are people who had put off elective surgeries and other kinds of healthcare needs because of the pandemic and had scheduled, and they're continuing with those. But also they've had a lot of challenges in our unhoused population and our homeless shelters, and that many of those individuals are the people who have gone to the hospital. So they're feeling very comfortable with, in San Mateo County, I can't speak to other counties, but in San Mateo County, with the number of patients in the hospital right now. We know that many families would be economically harmed if schools are closed because parents cannot go to work. Many families suffered economically when we were shut down, had to leave jobs. And then the other thing is, if we're thinking, well, why not just 1 or 2 weeks while the surge passes? That's sort of faulty thinking, because 1 to 2 weeks of school closure is not going to solve the challenges. I don't think COVID will just magically disappear. And then you've got a whole nother set of challenges of getting everybody back, getting everybody started up again, getting all the routines going. And that's really actually quite a bit of strain and distraction on just keep school open and keep going. I think I have 2 more slides. We do have boosters now approved for the 12 to 15-year-olds. So we want to do everything we can to get those kids their boosters. Additionally, for the boosters, they shortened the time period between how long you have to wait till you can get your booster. So it's now 5 months since the Pfizer or Moderna vaccine was received. And then I want to thank all of you for hosting school-based vaccination clinic for 5 to 11-year-olds. We vaccinated more than 1,200 5 to 11-year-olds last week in San Mateo County. And many of our school nurses across the county are working after school to run those clinics for us. So it's really quite an amazing operation. And finally, there's a slide just for where families can look at the schedule for vaccinations across the county. And I think also on that link, the My Turn link, you can register or sign up for a booster shot. So hopefully that provides a little bigger picture. That's a lot of information, but you have the the presentation to pull from if you, want to discuss it and review it in your own time to think through it. So thank you for giving me the time to talk through that. Thank you.
I have a question regarding the Johnson & Johnson shot. So for boosters, they're now recommending not to get Johnson & Johnson.
Right,
So-
I believe that any of the other boosters work if you have the Johnson & Johnson.
Right.
So, yeah. So the message is we want everybody to get their booster, even if you got a Johnson & Johnson.
So if they got Johnson & Johnson, then they can get a booster of Moderna or Pfizer, it doesn't matter.
Correct.
And I'm just asking for clarification.
Yeah.
So if you receive Pfizer, can you get Pfizer or Moderna, or you're recommending just Pfizer?
I think it's, for kids, it might be different, but for adults, I know you can get any
You can
booster.
swap, okay.
For kids, they might want you to stay aligned. I'm not completely sure about that.
Okay, and boosters for kids are only 12 and up. They're
12 and above, yeah, because the 5 to 11-year-olds are still getting, just getting their first vaccination. Right.
Okay. Any other questions?
Yeah, Ms. Magee, you mentioned going to my turn. Just recently, there was families that came to attempt to get tested, and
Yeah.
we had walk-ins available, but that was a very short time frame. So what happened is a lot of families went online to my turn, and the closest one was to go to Oakland or way down south. So how can we ensure that we can have more tests available, just like in our community alone?
Are you talking testing or vaccination?
Testing.
So
Testing.
Yes.
So I'm gonna answer that,
Okay.
because that's actually part of my presentation.
Perfect.
But I'll answer it now, I'll answer it again later. But I'm gonna come over here because I got a text that people now sound muffled, but when Superintendent Magee was speaking, it was perfect.
I think we need lapel mics.
We need a lot of things.
Okay,